As we've talked about at these meetings, Maine has been sequencing positive samples of COVID-19 across the state over the past several months. This sequencing allows us to understand the various variants that are circulating and being transmitted across the state. Indeed, Maine ranks as among the top states for the percentage of positive samples that we ultimately sequence. As a result of that work that we've been undertaking, we've just detected the first instance of the B.1.351 variant in the state of Maine. This is the variant that was first initially described in South Africa in December of 2020. We have just detected the first instance of that variant here in Maine. Now, detecting variants of this sort, whether it's the B.1.1.7 variant that first detected in the UK that we've also found in Maine, or the 351 variant first identified in South Africa, detecting variants of this sort is not unexpected. Indeed, because Maine ranks among the top states in the percentage of positive samples that we do sequence, it's not unsurprising that we would find them. Indeed, what we've seen throughout the pandemic is that in public health and in life, when you go looking for things, you find them. And that's the situation here. We've been diligent and deliberate about setting ourselves to understanding which specific variants of the virus are circulating in Maine. And thus, because we've gone out deliberately to search for this variant and all others, it's not unexpected that we would find it. Now, what does any of this mean for you? Well, I think there are two big things. The first is that the presence of variants of this sort, like the one first detected in the UK and now the one detected initially in South Africa, the presence of variants of this sort underscore the need to keep up with common sense public health measures, like wearing a mask, like making sure you're remaining physically distant as much as possible. The common sense public health measures that have gotten us this far in the pandemic will continue to be some of the safest things that we can all put into place to keep ourselves and our communities safe as variants of this sort may continue to be detected. The second thing I think this means for you is when your turn for vaccination comes up, don't say no. In light of the variants, in light of what we see happening across the globe with COVID-19, when it is your turn to be vaccinated for COVID-19, please make sure you take that opportunity and get that vaccine, because in light of these variants, being vaccinated plus keeping up with common sense public health measures like masking and physical distancing remain the best things that you can do to keep yourself safe, to keep your family safe, and to keep your community safe.